Thank you very much for talking with us, Doctor. Please introduce yourself for us.
My name is Gavinash Persaud. I'm a medical doctor practicing for the past 10 years, and I'm currently attached to the Industry Health Center, where I'm primarily working with chronic disease patients, principally diabetic patients, and I'm here now. I've been seconded temporarily to oversee our surveillance, our COVID surveillance department here at GPHC.
So tell me what you do.
Okay, so I work, I have a master's in diabetes, and I attend to all the, chronic disease patients, persons who are suffering from diabetes.
Mm-hmm. And so now you're in the triage section. Many people still don't understand that word. Explain what happens at East Street entrance at this hospital.
So at East Street entrance, we have two sections. There's a screening point, and then there's the other point, that's the triage. So persons who are accessing the hospital are asked a couple of questions, primarily to evaluate if they have any respiratory affection. Temperature is also done because we use an infrared thermometer to determine if that person has a fever. And persons who are screened positive, meaning that they would have some sort of respiratory complaint, along with a documented temperature, then passes over to the triage section. There, we have doctors who follow a checklist. We evaluate each patient, assessing what they're complaining about, and then when we make a judgment, whether that person could potentially, or between commas, suspected of having COVID. From there, if necessary, we do an X-ray, or we consult with the other services, primarily internal medicine. A doctor then evaluates that patient, and we decide a conduct. Conduct could either be that you go home to self-isolation. You could be admitted, if you're critical, to the isolation unit that we have, or you could be sent to one of our holding areas for self-isolation or quarantine over a period of time.
Mm-hmm. So how long does that process take? Let's say I come and I'm screened. How long does that take before it's determined what happens with me?
So it generally don't take long, because we have, at any given point in time, we have 3 doctors who would see patients. We also have, during the week from Monday to Friday, we have a pediatrician or a pediatric doctor who also sees patients. So I would say approximately 10 minutes. Within 10 minutes, you would be able to have your situation determined, assessed.
And how many hours do you work down there?
So currently we are providing 24 hours of service, because we need to protect the hospital, we need to protect our healthcare workers. So we run a shift system, 8 hours, and it's continuous. It operates for 24 hours. East Street is not the only location, because we also have New Market Street out at the front. So persons who screen positive there would also go to the back to be triaged. And persons who screen positive or those who are accessing the maternity service would also go to the back to be triaged, and persons who are at Middle Street. So all our entrances to the hospital is screened.
Give me an idea of what patient would end up in the COVID isolation unit here.
Patients who are having serious respiratory difficulty, we see that they're having difficulty breathing, who are having work of breathing. In some cases, they are not saturating well. They would have an X-ray that is indicative of some pulmonary lesion. Those are the patients. Perhaps maybe they have a serious underlying condition associated with respiratory problems. It's individual. It's not, I can't give you to say, if you have this, then that happens. It's individual, and it's assessed on a case-by-case basis. What I can say is that these persons who go there have severe breathing problems.
And doctor, of course, when people come for screening or triage section, they're anxious. What do you want to say to those people when they end up there?
So a lot of persons access our service primarily because they're fearful. So how do we help? When we screen them, we give them reassurance that nothing is happening, or maybe they're screening negative for now. We give them advice, the generic advisors out there. Persons can use vitamins, they can drink lots of water, they can practice hand hygiene, and most importantly, social distancing. And the fact that it's a medical person who's giving them this advice has an impact, because they tend to respond well to that piece of advice provided by a medical professional.
So you haven't really had a lot of people behaving bad when they go there?
Yes, we've had a few cases where persons come with expectations. Some persons, they believe that because they would have had contact with a sick person, and I'm talking contact such as passing nearby or being in an area with that person, and some of them come, they expect to be tested, for example, but they don't have any criteria to be tested. So sometimes they do give us a few words that are not so friendly.
Dr. Persaud, you deal with chronic diseases, as you said before. The deaths that result from COVID-19 are mainly, correct me if I'm wrong, because of those underlying conditions. What can a person with chronic diseases like diabetes do to help protect themselves so they don't end up seeing you?
Right, so persons who are having any chronic condition, and in this instance diabetes, they are already immune suppressed.
What does that mean?
Immune suppressed meaning that their body is not having enough resistance to fight off the virus, unlike someone who doesn't have a chronic disease. So persons who are suffering from diabetes should ideally endeavor to have their sugar values controlled within the normal limits. They should adhere, take their medication, stay hydrated, practice social isolation because you don't want to contract the virus, and stay on top of your treatment.
Doctor, is this a special challenge for you working in this department at this time?
Not at the moment, because as we have started, I think, on the 19th of March, and from then to now, as problems, well, we have evolved, and each day it's getting a bit easier because we are gaining experience. We have difficulties that arise, we solve them, and it's running smoothly. So the challenges are there, routine challenges, but not anything that we cannot overcome.
Thank you very much.
You're most welcome, Mark.